Welcome to In the Clinic by Dr. Butch Levy. This month's episode is titled Multiple Sclerosis.
Hi, good morning. This is Butch Levy. We're going to talk today about multiple sclerosis. And while its definition is not quite as clear-cut as an autoimmune disease as we see in some of the other diseases like lupus or thyroid, Hashimoto's thyroid disease, or ulcerative colitis, we definitely know that there is a component related to an imbalance in the immune system. We'll talk more in depth as we move forward. This is a disease that attacks the myelin sheaths, the fatty insulator around the nerves, and it creates these plaques or lesions that are characteristically seen on MRI. What happens is that you have these lesions that disrupt the normal electrical messaging between the brain and the nervous and the peripheral nervous system. And so the signaling is dysfunctional and symptoms develop as a result. It's like you have a wire in your house that has some kind of damage to it. You don't get the clarity of electrical conductivity that you want to have for your devices. It certainly is the result of some form of immune dysregulation. And there are multiple factors that people are seeing. Lifestyle things like smoking, climate. The farther you are from the equator, the higher the risk of developing MS. Genetics. There certainly are people that have a family history of this disease, but also we see environmental burden and pathogens, especially Epstein-Barr virus, as being big players in terms of what goes on. And we'll talk about how these interplay together. So it is the most common inflammatory demyelinating disease that we see in the central nervous system. When biopsies are done, the B cells that make antibodies, the T cells, and the macrophages, which incite the cytokine activity for inflammation, are all seen in these biopsy reports. So I think how people view this is that you have these infections, viral, bacterial, or toxins, things like metals and chemicals. So they trigger an excess response of the immune system. And this alters, changes cell recognition in some way by altering the Th1, Th2 balance. So even though they haven't found a specific MS autoantibody, you can certainly measure autoantibodies to myelin. And if you have something in this categories that we're talking about that's creating a lot of inflammation, ultimately, if that inflammation ramps up to the point that it becomes beyond the normal controls of regulation, you can get an overactive or hyperactive immune system. And that's considered something that's more in the autoimmune lines because it's controlling itself rather than being regulated by our normal mechanisms in the body. So we definitely see things like BPA correlating with myelin antibodies, benzene, dioxins, air pollution. And I'm sure when we talk about lifestyle earlier about smoking, probably the carcinogens create an inflammatory milieu. I think part of it is that we've talked about is that the blood-brain barrier also can have antibodies related to chronic inflammation. And we used to think it was impenetrable, and now we know that different chemicals and infections can penetrate the blood-brain barrier. So we have this perfect storm, like with other autoimmune diseases, where you can see instigating or initiating causes. You can see antibodies to certain components of the brain, the blood brain, the myelin, but as yet the ability to connect those as the cause of MS is somewhat elusive, but appears to me that there's no question that that's what's going on. So our treatments are going to come down to not only balancing the immune system, but dealing with the root cause of what's affecting the system to be causing this generation of the chronic inflammation. So the other thing we often see is allergens, GI problems with food, or leaky gut from, again, infection, SIBO, problems with autoimmune triggering bacteria, mold, mycotoxins. This again causes unusual proteins to be leaked out of the gut that can cause the immune system to overreact. So if autoimmune disease has a level to it that involves overstimulation of the immune system to where the point where it starts failing to be in harmony with our cells in the body, you can see different types of damage possibly occurring. So let's talk about the clinical signs and symptoms, which I assume most of you are familiar with. So I think the important aspect is they are these distinct episodes that affect our central nervous system, be it our vision, be it our strength or feeling in our arms and legs, or spinal problems. And usually the symptoms tend to start remitting and getting or improving over weeks or months. Now, the level that the return is to the initial strength or feeling that you had might be affected that you don't go back to 100%. But it can affect the ascending tracts, which are what carry our sensory information, or our motor tracts, which carry information to move our muscles. They can affect the optic nerve, and they can certainly affect the brainstem. So just talking about this, you can see visual changes, nystagmus. You can see brainstem effects on speaking, and you start seeing these effects on the sensory motor system where you have a loss of vibratory or position sense. You might have imbalance related to gait. There could be weakness all the way to paralysis of limbs, and often muscle overexcitement, spasticity, or tremor. So these all relate to the effects of this damage to the nerve electrical conduction, that they don't carry the same messaging. Also, since the spinal column and these sensory motor nerves travel up and down to organ systems, you can have bladder dysfunction, bowel dysfunction, fatigue. Obviously, if you have this immune overreaction, it's not uncommon to see people develop cognitive impairment and sleep problems. And one thing that people don't necessarily recognize is this persistent neuropathic pain that can come on, where there is a pattern that's set up that the nervous system gets into a regenerative cycle where you start having pain symptoms without the stimulation that's causing the pain to be there. And these are very difficult to treat.